Hello, and welcome to Communicating with Patients About Genetic Testing, presented by the France Foundation. Patients may not be aware that up to 10% of breast cancers are due to specific mutations in single genes passed down in a family. Therefore, if patients are identified early as having a genetic risk, this can lead to heightened awareness, surveillance, and behavior modifications. Specifically, the benefits of genetic testing include improving understanding about cancer risk to guide medical management and providing information to help people who have been diagnosed with cancer make treatment decisions, including treatment with targeted therapies and risk reduction for future cancers. In addition, testing affects eligibility for some clinical trials, and research studies in genetic testing can help family members understand and manage their risk for cancer. Specific patterns of hereditary breast ovarian cancers are linked to mutations in the BRCA1/2 genes. The NCCN guidelines are an excellent resource for BRCA-related genetic testing. The NCCN recommendations indicate that individuals from a family with a known deleterious BRCA1/2 mutation should be considered for genetic testing. For patients with a personal history of breast cancer, the guidelines provide criteria that help to identify individuals who should consider BRCA1/2 testing. These criteria can be reviewed and discussed with patients. For patients with breast cancer who meet the criteria for BRCA genetic testing, follow-up includes risk assessment, counseling, education, discussion of genetic testing, and informed consent. Genetic counselors play a critically important role for patients and family members. Before ordering genetic tests, a counselor will inform patients and their families about benefits, risk, and limitations of test results. This will include a discussion of the distinctions between positive, such as pathogenic or likely pathogenic, negative, indeterminate, and inconclusive, variants of unknown significance. Importantly, a genetic counselor will collect and assess detailed family history, obtain informed consent, and help the patient navigate payer coverage for genetic testing. Counseling after genetic testing will include interpretation of test results in the context of personal and family history of cancer, with implications for the patient in terms of treatment options and medical management. The discussion will also include the implications of the genetic testing results for family members. The counselor will also provide patients with relevant disease-specific resources and psychosocial support. For patients who have a test outcome that is positive for familial BRCA1/2 pathogenic, likely pathogenic variant, communication of the risk to family members is extremely important. A duty to warn letter may be used to inform relatives of such a test result. You can find an example of this in your handouts. Thanks for joining us, and remember, genetic counselors are important members of the oncology care team.